general idea of what a stroke is, but you may not know what to do or even what the symptoms are. Well, May is Stroke Awareness Month, and for that we wanted to bring in Dr. Eileen Grandis, a vascular surgeon with Bayfront Health. Doctor, thank you for being here this morning. So we looked up some of the numbers and they're staggering. This is important information because stroke is the 5th highest cause for death and the leading cause of disability in our country. So let's just start with some of the basics. What is a stroke?
Well, a stroke is simply a lack of blood flow to a part of the brain that leads quickly to cell death. Brain cells can die within an hour or so. The quicker we identify a stroke, which is the lack of blood flow to the brain, the quicker we can actually fix it. There are two main types of strokes. One is an ischemic stroke where there isn't enough blood flow to the brain because there's a blockage due to a clot or a piece of plaque. The second type of stroke, which is a lot less common, only about 10 to 20%, is a hemorrhagic stroke, which is bleeding. So because 80% of strokes are due to a piece of plaque breaking off or a clot, those are highly preventable. We want to catch it early because time is brain.
All right, well, let's talk about that. How do we catch it early? There's something that you talk about. It's called Be Fast. What is that?
Yes, Be Fast is just the symptoms that we look at for our patients.
Okay.
And we have our patients look for these at home too if they don't know if they're having a stroke. So it's a mnemonic, and everyone learns very easily by mnemonics, hopefully. But
Right.
B is balance. And if you have a change in balance where you're suddenly stumbling or you can't feel something with your foot and you lose the ability to balance. Eyes, sudden blindness. For example, a lot of people will have sudden blindness in one eye or field cut where they can see the top but they can't see the bottom, or
Okay.
they can see the middle but they can't see the sides. So that's the sign to immediately go to the emergency department and not your ophthalmologist. Facial droop. So you smile suddenly and part of your face can't smile. Arm weakness and leg weakness. If you're weak on one side or numb or tingling, that's certainly a sign of stroke. Speech, if you have sudden slurred speech or the inability to talk, where you really want to talk but your speech comes out all garbled, that's very, very concerning for stroke as well. And time. When these symptoms start occurring, definitely do not go home and sleep it off.
Right.
Don't try to take a nap. They won't get better. And in many cases, yes, take it seriously. In many cases, it will get worse. Or you can have another stroke in a very short time period. So we want you to go see, when you see these symptoms, to call your medical professionals, go to the emergency room very quickly. Because again, time is brain.
All right, and be fast. That is a key there. So here's the question: how can you prevent it? What can you do to lessen your chances of getting one of these?
So one of the main risk factors for having a stroke is uncontrolled blood pressure. And we really want your blood pressure to be 120 over 80 or less. A lot of people live at home with slightly higher blood pressures, but if you're having persistent spikes of blood pressures or persistently high blood pressures greater than 150s, 160s, 170s, you really need to get that checked and go see your primary care to control that. Other things you can do are everything else that's heart healthy. You can exercise, low cholesterol diets. A very plant-based diet has been shown to decrease the risk of stroke because it decreases the risk of plaque formation. Go see your doctor for regular checkups. Definitely have your heart looked at. One of the major causes of stroke, again, are clots from the heart. So we want you to make sure that everything you do for your heart and everything you do for yourself that's healthy is really good for preventing strokes too.
We'll help you here as well. Dr. Grandis, good information. Thank you so much for joining us this morning.
Thank you for having me.
All right.